I see Robo as a very important individual, able to reach children in a way that often we can't reach them with verbal communication from adult to child.
The Children's Hospital has proven to be a really powerful place for Robo to be because Robo is able to do therapy with the children and wouldn't be able to in other settings.
And I see Robo as one of those tools that we use, and a very valuable tool as Robo interacts with the child and puts the child at ease, and that child is able to forget the procedure for a minute, to learn how to cope with that procedure a little bit better.
To a child, Robo is like Santa Claus, very real, not something that you changes with putting makeup on or taking makeup off.
I think he permeates a child. That's what I think happens.
Clowns are as old as time itself. We find them in the most ancient of civilizations, often in the form of a medicine person or a healer who does clowning. We also find them in theater all over the place, Greek theater, Renaissance theater, Shakespearean theater. And we find them in medieval life in a very powerful way, both as the jester of the court, who was the healer for the king, and also in the village idiot. And that was an actual role. It wasn't, we sort of think now of village idiot and we put it down, but it was an actual function within society to be the order breaker for the society, the healer for the society. Robo contributes to the therapeutic milieu in the hospital in a number of ways. By being the order breaker of the hospital, you get your normal setup, structure of the hospital with the doctors and the nurses, and everything is all set and normal. And then suddenly this clown, this idiot, comes running wild through the hospital, doing all these crazy things, and that breaks that kind of order and allows healing to take place for the children and allows the release of stress and healing also within the people within the hospital.
Robo, I understand that you have a blue puffer. Yes. I'm going to give you my practice one. I'd like you to show me how you normally use yours. There you go. Are you having trouble remembering? Okay, whenever you're ready then. What are you doing, Robo?
Well, as an administrator of a hospital, I don't often get approached about funding clowns. I thought it was quite a novel thought. I wasn't sure whether this was another play therapist, somebody to entertain children, or exactly what it was. I quickly found out exactly what was being referred to, and I very quickly became very supportive of the idea.
When we wonder about how a clown could fit in with our program, we have to sort of go back and say, how did it all begin for child life, and what did it mean for child life to have a therapeutic tool? And we have many therapeutic tools. There is medical play, there is play therapy, there are our medical puppets, and each one has its own purpose so far as working with children in different kinds of problem situations. But when I take a look at Robo, I see something that no other therapeutic tool could cover. And that is, and I hope I can explain it well, we're looking at a mime clown who doesn't speak, who has a sort of a wistful kind of an expression that can allow for many things. First of all, Robo can be just idyllically happy. Robo can be very sad. Robo can be shocked and surprised. And Robo can be helpless. For me, they're all wonderful traits, but the helpless Robo, for me, is the one that I seem to watch so carefully. Because what happens is that children are helpless in hospital. And what happens to them is that sometimes they withdraw into little shells. And they almost become mimes themselves because the expression on the face certainly will show, but they may even not engage us in conversation and they may not reply to us. But because they see there before them this wonderful, warm, helpless creature, if you want to call Robo, they seem to come out of their shells and they go after that clown.
Robo is not so much a stage performer as a clown that can interact with people and do therapy through that. Robo has a real capacity for warmth and caring, and that's something that people respond to very quickly. And for some reason in a clown, you can respond to that, whereas in a human being, you don't allow yourself to respond so rapidly to that. Also, Robo is very interesting. Robo is the person to whom care is given. Robo's a bit of a klutz. He wanders around, lost, bumps into things. And one of the things that the children do is that they give care to the clown. That's really important in a hospital, because in a hospital, children don't have control over what's going on. And they also aren't caregivers, and it's a very human thing to give care, and very important for humans to give care. And with Robo, they are able to give care, whereas to no one else in the hospital are they able to do that. And also with Robo, they're the ones that are in control. Usually they're lying there and people are doing things to them and they don't have any say about the matter. But with Robo, they control Robo's actions. So you'll often see that they become really quite bossy with this clown, but it's wonderful. It's an outlet for them to be able to control and to give care. It's also a chance for them to be the people who know what's going on, because Robo doesn't do anything right. Robo's hat is on upside down. He can't tie his shoes. He can't go through a door. He can't fill a glass of water. There are all these things he can't do. He reads books upside down. He can't eat properly. And the children have to teach Robo. And again, they're the people who know what's going on for a change, and Robo is the one that doesn't. And again, that's different from what you usually have in a hospital setting.
Are you hurt? Where are you hurt? Where do you hurt? Your arm? Everything's gonna be okay. I'm gonna help you to relax and make some of the pain go away. Now listen to me. Breathe easy. In through your nose. Slowly out through your mouth. In through your nose. Out through your mouth. In through your nose. Very good, Robo. You're doing a good job.
I think the nursing staff see Robo as really assisting the children. Children certainly are confronted when they're in the hospital with so many strange procedures, and just to have somebody who they can laugh at, who they can interact with, who isn't going to do anything threatening to them. I think that the nurses see the value in Robo and what Robo does to help the children through some of their more traumatic times.
It's been beautiful to see the reaction of the physicians who react like everybody else to Robo. And don't even realize they're doing it at the time that they're doing it. So there's a very positive response to Robo.
Often children communicate to Robo things that they don't communicate to other people too. Fears that they have about pain or fears that they have about hospitalization. And again, that's something that Robo can communicate to the healthcare staff so that they're aware of how the children are feeling and what needs the children have.
And what perhaps is even more interesting is seeing staff relate with Robo. And this has been so exciting to see staff being able to say certain things emotionally that they might not verbalize to another colleague, and yet somehow it's allowed when you're communicating with Robo.
I'm thrilled with the response of the rest of the staff. It's very interesting. If you look almost to the beginning of child life, you will know that you sort of are perhaps an injection into a program. So are you going to be an intrusion into the program? Are you going to take over from somebody else where the children will say, I want Robo, I don't want you. This is the sort of thing that happened with us in child life. A child in the beginning, the nurses, and I understood, they thought that the whole concept of play was taken away from them because here were these people coming to play with the children. And so we had to help each other to be part of the team. Robo became very quickly part of the team because everyone seemed to recognize that here was an added element that would help our work with the children. And the nurses adore Robo. The staff, my own staff, adores Robo. Robo is called upon constantly. We tried something which for me was an experiment that we needed to be very concerned about, and that was to see how would Robo manage in the oncology outpatient playroom, because that is a program that's well developed. The atmosphere there is very beautiful, but at the same time it's a very serious kind of a thing that's happening in there. Do you inflict that program with a clown? Well, what has happened is that clown has become, again, an incredible therapeutic tool, so that every Tuesday the clown is there. I've witnessed what happens. It's just, it can bring tears to your eyes because, again, it's another tool to allow the child to come out of himself, to not be concerned, to not worry about when is my turn to go in for that painful procedure. Things are happening around that child that help him to just have his spirits lifted. So I see no problem at all. I think that if Robo were to disappear, it would make a huge void in the program.
I've become convinced in the few short months that Robo has been within our institution that miming and clowning can be a very important part of a children's hospital. I do, however, think that it takes a clown or an individual who is very good at using clowning and miming for children. I'm not convinced at this point in time, simply because I've only experienced one Robo. I think that not every clown could do it. Not just anyone off the street could do it. Not every professional individual who earns their living by miming could do it. But though the beautiful combination of the professional clown with the understanding of the special needs of children, I think is just a tremendous combination. One of the children who had been a patient in the hospital over several months, well known to everyone, and a child who had had a bone marrow transplant, was an immunodeficiency child. When that child died, and at the funeral service, where the hospital chaplain was giving the service, I was told that Robo attended the funeral. And at first I was somewhat surprised about this because somehow we don't relate something as touching as a funeral of a child with a clown. And they were describing to me how, as the hospital chaplain who knew Eva, this child very well, would bring out various aspects of Eva, and as the staff who were attending the funeral and friends of Eva would be saying yeah and moving around, or sometimes maybe even laughing at some or smiling at some very special thing that might be relayed by Eva, that from the back of the church would come this very quiet tap-tap, which, as you know, is how Robo communicates frequently, is with the feet. And they described to me how everyone sitting there knew it was Robo, and how they were so surprised that it seemed so appropriate for Robo to be there, and to be there as Robo, and how beautifully and Robo was able to fit into the total ceremony and add dignity to dignity and completeness.
Well, seeing how well the projects work here, I would hope that Robo is able to continue at the hospital, because the hospital is the right place for Robo to be. I think for Robo, it's not something that was worked at so much as something that was a gift. And when something is given like that, there is a responsibility to use the gift in a proper manner. And so there is a responsibility for Robo to clown, because that's what the gift is to be a clown.